Hello, my name is David Armstrong, and I'm the Director of the Health Workforce Technical Assistance Center. Today's event is entitled Health Workforce Research Career Paths for People with Master's Degrees. Now, this event is co-sponsored by Academy Health's Health Workforce Interest Group. And before we get started, and before I introduce our guest moderator, I want to go ahead and tell you a little bit about the mission of Academy Health's Health Workforce Interest Group, or HWIG for short. The mission is, which I'm also a member of, and I believe a number of you out there are as well, is to improve health and healthcare by promoting research and disseminating evidence that informs health workforce policy and practice. And if you're interested in joining the interest group, now it is through an Academy Health membership, and you can, if you do so, you can contact either Xiao-Chu Hu or Debora Goldberg. Xiao-Chu is the current chair and Debora is the vice chair. And of course, if you join, there are advantages to membership. Beyond associating with a lot of great health workforce researchers, you can also use the listserv to share information such as career opportunities, etc. Now, we do have some other planned activities coming up in 2024. First of all, we're doing this webinar, but next we are also hoping to have a webinar on COVID-19's pandemic's impact on RN's practice orientation, so labor relations. This is scheduled for April 4th, and it features LaTanya Trotter, for those of you who know her. Great speaker, so we hope you can make it to that event as well. And of course, we will be having a session at the annual meeting. More information to come. And with that said, I want to go ahead and turn the event over to Debora. Debora Goldberg is the vice chair of the Health Workforce Interest Group, and she's from George Mason University. Debora?
Thanks, David. Hi, everyone. Thank you so much for joining our webinar today on career pathways in health workforce research for individuals with master's degrees. We're holding this webinar because we recognize the value of health workforce research that's conducted by teams that include people with different types of degrees from different experiences and backgrounds, and those that have expertise in different areas. We saw a need to explore in more depth career paths for individuals with master's degrees. We invited this great group of panelists to share their health workforce research and insights they've gained along their professional journey. So I'm going to take a few minutes to introduce our speakers, and then afterwards they're going to talk more about their careers and the research that they're engaged in. The first person I would like to introduce is Samantha Pollack. She's a research scientist at the University of Washington. The next person that we have is Jacob Rains, and I think he is joining us in a few minutes, so hopefully he'll hop on here soon. Jacob is a consultant with Mannett, Phelps, and Phillips. Clark Ruttinger is also with us. He is the Health Workforce Consulting Director at Global Data. He's also the founding director of the Utah Health Workforce Information Center. Nöel Smith is also with us today, and Nöel is the Senior Director, Physician Assistant in Industry Research and Analysis at the American Academy of Physician Associates. So you can see that the panel members that we pulled together today, they work in different types of settings, some in academia, some in consulting, and others at professional associations. So I am going to start off with the first question, which is I want to ask each panelist to speak for 3 or 4 minutes about your employer, your position, and the industry sector that you represent, and the career pathway that you took to get where you are today. Clark, Samantha, Nöel. Clark, do you want to get started on that?
Yeah, I'd be happy to. Thanks. I'm glad I was able to get my technical difficulties solved. So hopefully we'll get Jacob on here as well soon. Yeah, my path to where I'm at now, I don't know. I mean, my goal was, I was told to go to college, and I didn't even have a goal to get a master's degree, but went to college and found an area that I was interested in. And I got a master's in public administration, and I found a job within state government where I was doing research for health workforce programs in the state of Utah, and surveying those groups, and got to understand why we were surveying those professions and what you did with the surveys in terms of modeling, and was able to connect with academics and people working across the country as I attended conferences and listened to people talking about the problems they had and the use cases for the data I had. And over time, I did a lot of work. As you mentioned, I was the founding director of the Utah Health Workforce Information Center. And that was from a lot of work with stakeholders in that state on what their needs were to improve the analysis and advice given for making policy. And so I worked with stakeholders, and we made a bunch of policy changes that ended up in legislative changes to improve data collection and improve how that data was given to stakeholders in the state to improve policy making. And then we had a big election, and this is what happens is elections cause change in government. And so my position was changed, and along came people that I knew from consulting that were interested in recruiting me to come work for them because of what I'd learned. So I had an opportunity to change positions about a year and a half ago, and I came and joined this team. And so now I get to take a lot of the work that I learned how to do in Utah and from talking with stakeholders across the country, and I get to apply it to talking with stakeholders in other states. And we do a lot of work for the federal government as well in doing national projections of the health workforce, but also get to go in and talk to stakeholders in states that maybe haven't prioritized health policy as much as Utah did or has. So it's been a great opportunity to learn from what's going on in other states, and that's where I'm at now. So.
Thanks, Clark. Samantha?
Hi, everyone. I'm Samantha Pollack. I'm a research scientist at the University of Washington Center for Health Workforce Studies, which is in the Department of Family Medicine research section. And I'm a little earlier in my career than Clark. I've been with CHOOSE for it'll be 6 years in the fall, I think. And with UW, I guess, for almost 8 years. And let's see, my role as a research scientist, I'm involved in all aspects of the research process, from helping conceptualize the projects to conducting surveys and performing data analysis, and then working on papers and other dissemination products. And so I represent my sector's academia, I guess. And my pathway to get here, I guess I was pre-med and undergrad, and then figured out that public health was a option and that I didn't want to go to med school anymore. And so then I went and got my master's in health science from Johns Hopkins. And I think that's kind of just an MHS is just a Hopkins degree. I haven't really come across it other places. It's the most similar to an MPH. And so it was a really research focused program. We shared most of the same classes as the PhD students in my department, which was health, behavior, and society. And so I kind of knew that I wanted to go into research, and a lot of my studies there focused on methods and kind of everything I do now. And then we had to do our own thesis project. So it kind of got me ready to either go to do a PhD or to go into research. And so then I have had one other position at UW before my current one, and it was working on more internal analyses of medical students for the School of Medicine. And from there, I jumped to CHOOSE, and I've been here ever since. And I'm grateful to be here.
Thanks, Samantha. Nöel, do you want to tell us a little bit about your position?
Great. Thank you for having me here today, first and foremost. Again, my name is Nöel Smith. I am the Senior Director of Research at the American Academy of PAs, and I have been in my role for the past 9 years. APA is a professional association, and we represent physician associates within the greater health workforce ecosystem. In my role, I oversee all of our research programming, from member products such as our salary work, getting feedback from members via surveys and focus groups, working on grant outcomes for education. We also do some clinical outcomes work with PAs. And I also get to support our advocacy work. It's really, really varied, and no 2 days tend to be alike. On my team, I also try to make sure that we write 3 to 4 papers a year. So we're still involved in peer review publications. Our newest one was just released this week in the Journal of Medical Regulation on medical malpractice payment reports of PAs related to state practice laws and regulations. So my background here is a little varied. It's in social sciences. I was on the road to getting a PhD in clinical psychology. And I had chosen that pathway because I really wanted to teach and engage in research as my career path. And it was probably about a year in that I realized that academia was not the right environment for me personally. And so I realized that at that point that I would leave after getting my master's. What I'm grateful for is that I received a really strong research education over the course of the entire 8 years that I was in school for undergrad and grad. I entered the field of workforce research as a broader area immediately after I got my master's, and I started working at a professional association, managing a large federal data set and transforming them into usable findings for policy development. So again, it's always been about how do we harness the power of data for policy. And from there, I moved to another professional association where I developed a benchmarking program. Again, how do we develop policies that help the constituents that we're working with? And eventually I left that position and I became a consultant for about 8 years. And I joined AAPA in 2015 after working as a consultant with them. It's here that I've honed my skills as a researcher, I think. I love learning new skills and engaging in a wide variety of research, and I get to do that, which is really, really cool. So, for example, right now, we're moving into harnessing the power of claims data to show clinicians' roles in healthcare systems. New skill set, cannot wait to take that on. And we staff our team with all levels of researchers, and everyone is involved from the development of a project to writing the IRB, to executing the work, to the reporting, to doing outside consultations, to speaking, much, much more. So kind of the sky is the limit to what we get to do within the health care association world. Thanks.
Okay, great, Nöel. Jacob, the panelists are all, we've asked the panelists to talk about your position and the industry sector that you represent and your career pathway to get where you are.
That sounds great, and I apologize for the Zoom difficulties earlier. It's great to be here. I'm Jacob Rains. I'm a consultant at Manette Health. Manette's an integrated consulting and legal practice with a little over 200 professionals. We do a lot of work primarily focused on the Medicaid program, but also other health programs that states run. We also work with providers, life sciences companies, and pharmaceutical companies. Specific to my work at Manette in the workforce space, I primarily work on behavioral health and home health workforce issues, specifically with both nonprofit research organizations and states themselves that are looking to leverage their workforce to lower costs and improve quality. And as folks know, there's through the American Rescue Plan Act and other stimulus bills over COVID, been a lot of dollars invested in workforce activities. And it's important that those are leveraged in an evidence-based manner. And so that's really where, you're combining this knowledge around research with policy to inform the direction of those investments. A little bit about me. Prior to Manat, I did my master's in public health at the University of North Carolina at Chapel Hill. While at UNC, trained at the Shep Center for Health Services Research on the workforce team there, and I'm still a research affiliate at UNC, so still touching on academia and fortunate in that regard. And prior to that, spent time working in a state legislator and on Capitol Hill. Looking forward to answering your questions.
Okay, thanks, Jacob. So I have several questions that I'm going to be asking the panel members to address. We also invite attendees to use the question and answer feature in the center bottom function of the webinar to ask questions. And so we'll be looking at those throughout the webinar, and we will try to answer your questions as we go along. And we'll try to save some time at the end where we can address questions. The second question that I have, and some of our panelists have already talked about their master's degree programs, and so we want to dive into that a little bit more in depth. So we know that there's different types of master's degree programs, and so some of them are more professional degrees, such as a master's in business administration and a master's in healthcare administration. There's other master's degrees that are more research oriented, such as a master's in biostatistics, a master's in science and clinical research. Even, as Jacob said, a master's in public health has some coursework in research. So we're asking some of our panelists to talk about the types of methods that you use in your research and how your master's degrees helped you prepare for a career in workforce research. Can we start off with Samantha?
Yeah, thank you. So as I said, my degree master's in health science was quite research focused, and it was kind of a feeder program for people wanting to go on to their PhD. So it was really heavy in biostats and also qualitative methods. And then we had the opportunity to do our own like mini dissertation, a little thesis, where we got to really use everything we learned over the 2 years, methods wise. And so, yeah, I think that I've used pretty much everything I learned in that program so far, especially in my role now where, like I said, I get to work on all aspects of the research process. And although my degree was focused on social factors in health, and now I'm on health workforce, so all of the methods apply. And even the way we approach questions and get projects started translates as well.
Okay, great. Nöel, you talked earlier a little bit about your master's degree. Can you tell us a little bit more about how that's helped you in your workforce research?
Sure. So I will say, first and foremost, even my bachelor's was very research focused. So, taking stats all along for, 3.5 years of that degree. So, in clinical psychology, you think about, and it's a Master of Arts, you don't necessarily think about it as a really rigorous research program. But the reality is that pretty much half my coursework were statistics, optional statistics class, methodology classes. And when you weren't doing that, you were working to understand the research because we're being prepared to go out and become researchers. I will say that there are definitely things that content was lighter on. So things like some of the more advanced modeling, that's not what my background was. So I've had to really work to pick that up along the way. I've also had, I will say, no focus on qualitative research. other than the fact that I was trained to be a therapist. And so you learn how to ask questions, right? To be able to solicit, to go in the direction that you're looking for. So it's kind of pulling from that really, really broad variety of skills. But I will say that probably at least half of my capabilities now are derived just from on the job training. It's going in and making sure that you're always trying to learn new things and continuously just growing, because even what we thought to be true, like statistics wise, that things that I learned back in the 90s, people on my team are like, oh no, those aren't the current assumptions. Like, how does math change over the years? But it does. So you have to stay constantly kind of learning and engaging as well. And I think any master's degree program, if you go in learning and wanting to continue to grow, will set you up for success.
Clark, do you have anything to add?
Yeah, I think I come from maybe a little bit of a non-traditional track in that my master's program was in public administration. And when I went to get a master's degree, they said, well, you'd probably be a better fit with your interest to our public policy program, but that program's not starting for another year. And I didn't want to put off my program, so I jumped in and I took all of my electives as qualitative electives in research or quantitative electives in research, because those weren't required at all to be an administrator. I just had to know how the government worked and how nonprofits worked. So I actively went out and looked for how to do data analysis. But I think thinking about these degrees, there's a lot of overlap in if you're in healthcare administration or in business administration or public administration or any of these, you're going to learn how to run a basic regression. You may not be the person running that regression. I have people that are paid to do that, but I need to know what that regression looks like and why I want that information. And more importantly, I have to explain it to people. I have to go and sit in front of a governor and talk to him about how our findings impact policy decisions. So again, there's a lot of overlap, but also I think that, again, example, I went and got an MBA later because my work would pay for it. But really then the year after that, they opened a master's in business analytics, which would have probably been much more interesting to me, but wasn't available. So, if you find something and you get some training, you're still going to have to do a lot of on the job continuous education. The data analysis methods that I learned in grad school, now people say that's called data science, right? And you have to kind of learn how to be a programmer, and that's more than running SAS or SPSS. And so, I've really pushed myself to learn how to code and write interesting data visualizations. And so I think that's just an endless place that I can continue to learn in. Let's see. Also, a place where I get constant demand is I do a lot of focus group interviews. Just we make these quantitative projections, but then people say, well, that doesn't look like what I'm seeing on the ground. So I've had to do a lot of qualitative interviews and learn how to do that interviewing process and then pull something out of that information. And so there's constantly something new to learn. And even if you get a degree in business, you can come in and apply those skills to doing research in this area, because really what's important is listening, being able to write things up and translate them into a way that the users of the information, are going to understand.
Great points, Clark. Jacob, can you tell us a little bit about how you learn new or modified research methods for software or other information that helps you in your current position?
I think it really hits on something that both Clark and Nöel highlighted, which is you have to be willing to seek out opportunities to develop those skills. And I'm thinking, within master's programs, every master's program is different. many of them have a fair amount of flexibility outside of the core curriculum. And so thinking about how you can best take advantage of that. So there were certainly, I would say, I attended a Master's in Public Health program. You get great training in biostatistics, for example. But if you want to do health workforce research, biostatistics might not be exactly what you need, right? And so had to seek out, Clark was hitting on, basic regressions. You're going to get that, right? But to go beyond that, particularly on the quantitative methods side, either coursework, for me, a lot of it was mentorship, that I am, very grateful that I was able to access. And on the, both quantitative and the qualitative side, it's just kind of I wouldn't necessarily call it on the job experience, because you can be doing it while you're in school, through internship, shadowing, et cetera. But that exposure, I came to Carolina, I had conducted many, qualitative interviews before, but without really rigid methods behind them. And, in just 2 years in a master's program, they were able to set me straight on this is how you do that. And I use those skills. Clark was talking about, modeling, and he's certainly the expert on the call in this regard, but I feel like every type of health workforce research, folks are going to have questions about your findings. And you should be talking in the field with people doing the work to really understand the meaning behind those findings. And so getting that training is so helpful. And it can be as little as reaching out to someone on LinkedIn and kind of having that initial conversation and trying to understand more about their training, and they can offer you advice there as well.
Okay, great. I'm so glad that our panel members talked about how they use both quantitative research and qualitative research in your health workforce research efforts. The next question we have is on, so we know that there's a lot of trade-offs in careers in workforce research for individuals with master's degrees. So sometimes this might be a benefit, but there might also be potential downsides. Clark and Nöel, can you talk for a few minutes about what you believe are the trade-offs and benefits of being a master's prepared workforce researcher versus having a PhD?
Yeah.
Nöel?
Nöel, do you want to go first, or I can happy to start? Yeah, I mean, there's definitely a lot of trade-offs. There's benefits to either career track, and I don't want to disparage anybody who's, really set or has a PhD. Certainly, I think you absolutely have to have teams to do this work. Frequently, as a longtime state government employee, I was invited to these research teams in academia full of PhDs because I was the government guy sitting on all of the data, and I could get them free data to do their research. But I was also the one who knew how to analyze the data. And so, I was, working with these academics who were very skilled in their medical knowledge, but they didn't know how to pivot table a spreadsheet necessarily. So there's trade-offs there, but I guess also just realizing that it doesn't require all PhDs. I guess the trade-off is that I'm never going to be the PI on the grant, but maybe that's not what I want to do. I'd much rather be making charts and graphs. So I guess another trade-off might be that I don't know, at least for me, I never had a goal of being a PhD. I wanted to do interesting work and pay my bills. And so I got to a point where I was doing interesting work and paying my bills, and to go further would have been just a cost to me. It would have been debt that I didn't want to take on, and it wasn't going to, advance me in my career necessarily. So sometimes you have to think about, do you want to be working in academia, or do you want to be the PI, or do you want to, be just doing something that you find very interesting? And, none of, master's degree doesn't prohibit me from also teaching or doing a lot of the things that somebody with more education might have. So, and on the flip side, I have friends who have PhDs from very great institutions, and they spend a lot more time in school than me, and they're not as far along in their career as I am because of it. So we really you have to consider kind of what your situation is, what you want, what's realistic in going out and attaining, and figure out where you fit.
Nöel.
Yeah, great point about being farther along, for example, Clark, in your career than perhaps some of your peers who may have gone to get a PhD. That's one of the top things, I think, at least early on, is that I was able to start working and engaging professionally. I didn't have the additional 4 years that, a clinical psych PhD takes. I was also, frankly, able to bring in more income than most of my peers who had stayed in school, at least for the first probably 10 years, because, junior faculty don't necessarily make a lot of money. They were also still in school for a long time. The downside is I have found that it has taken me longer to move into a leadership role than if I'd had my PhD much longer. And there have been times I've had to kind of prove myself or prove my value. Because I don't have a PhD, I have found that there are some academics who don't necessarily value the level of experience and knowledge that I bring to the table. And I think that's unfortunate. I don't think it's pervasive, but I think it's there. And I don't think I would have had to have done that had I, continued on for the PhD. One of the things I really love, honestly, because I do have quite a few colleagues I regularly work with who are teaching, who are in academia, I don't have to get funding. I can do what I want at my job. I can kind of create my own pathway within constraints because I'm still employed for a company, but I don't have to seek out funding to validate and justify my position. I don't have to seek out funding to be able to justify needing an additional staff on my team. And that's really nice. It is a level of pressure that I have never had to fulfill. And I think it's, to me, a huge benefit, and one that I really greatly appreciate, is that level of stability in what I do. But as Clark said, you're right. I'm currently working on a grant proposal right now, and I will never be the PI, and that's okay. But it is what it is, right? So if that's something that you want, that is something that you have to consider, is that those opportunities are not necessarily going to be available to you. It doesn't mean I can't be a co-investigator, but I just will never be the PI. Yeah, but again, honestly, I think having to prove yourself when that comes up is probably the biggest downfall to what I've experienced over the years.
Thanks, Nöel and Clark, for sharing. Jacob and Samantha, do you have anything to add?
I will say that I work with a lot of master's level researchers, and so I think that we are all very lucky to work on a team where our PIs know what we can do and the value we bring to the research at our team. And I think that's maybe a very unique role. It's hard to find, maybe. Definitely my position before this, I didn't feel like that. And so maybe that's if you can find a mentor or other team members that know what you can do and understand and trust you, that can go a long way. So
great.
Just to add in here, there's some real value in doing some reflection of which parts of the research process you enjoy most. And just to say that, there certainly are parts of the process, proposal development and being a PI has been mentioned a couple of times here, that generally speaking are going to fall onto a PhD. And there are other parts of the process that Samantha hit on that master's level folks really drive and are experts in. And you can be in a really good place doing those types of activities. Clark kind of mentioned doing some of the visualization work related to research on the interdisciplinary teams I've worked on. We've had great PhDs who do that work, but it's really been the master's level folks who are the experts there and are able to just communicate our findings in a much more meaningful way than when I write a policy brief or manuscript.
Okay, great. So many people might be surprised about some of the research conducted by master's prepared individuals. Samantha, Nöel, and Clark, can you briefly describe the type of research you're currently engaged in that you think would surprise others? Samantha?
Sure. So a lot of what we do is HRSA funded, and they're like one-year projects that are very what you would imagine academia goes through and quickly, but something that is, we also get funding from other places. And one of the things that I'm working on right now is a project called the Washington Oral Health Workforce Tracking Program. And I'm the director of operations for that. And it's funded by Delta Dental and the state of Washington. And so we pull together data sources from across the state and kind of make them all digestible on a dashboard that the public can visit. And then we're also, so we do a lot of secondary data analysis on all different occupations of the oral health workforce. So dentists and dental assistants and dental hygienists and dental therapists. And we're also conducting our own surveys. We just finished one on dental assistants, and we're about to start surveying dental hygienists in the state of Washington. So definitely not something I ever thought I would be doing, but it's research on a bigger scale, I think, than it's actually very public facing, and I really enjoy that. And as the director of operations, I kind of make sure everything is afloat and forward momentum. And so that is kind of fun as well. A little different than when it's just me and a data set trying to make tables, for my PI to go over. But it's like that, but plus a million other things. And that's pretty cool.
Oh, great. Nöel?
Yeah, I mentioned in the when I did the introduction that so most associations, they engage in like member research, like sending out member satisfaction surveys. Maybe you get to do general surveys, maybe you get to do focus groups, but I've been really excited. We have started moving into the area of claims-based data. And that is so challenging and so exciting to take on. So we have 3 different, kind of intro level projects that we're looking at, for example, that's looking at patterns of who's seeing new patients, right? Is there a pattern to new patient versus existing patient visits, and which providers are providing that care? We're looking at provision of medication assisted therapy. So who's providing that care, and does where you go to school necessarily make a difference, at least within the PA profession? So it's really diving in to a completely new area of research that we are not necessarily known for. And I will say, when we talk about collaboration and mentoring, that is one area where we are starting to build that. I'm starting to really build out that side of my network because it is a new area. But again, something that I think would be surprising. It's not just what I think most people would necessarily think of is in terms of the type of work that we're engaging in.
Great, thanks, Nöel. Clark, what kind of research are you engaged in that you think would surprise others?
I think, well, the two that are maybe most surprising to me or most interesting to me, and Noel mentioned claims data. Before I left Utah, I was building a graph database of the claims data in Utah to kind of do analysis of the primary care system. And so I agree, claims data is a great kind of up and coming place. If you can learn how to analyze claims data and get access to that data, I think it's really interesting. Another place that I've been working a lot in right now is kind of this qualitative component. You know, we're all good at interviewing people and writing up a summary, but how do I spend less time doing that, and how do I automate some of that? So I've been, digging into text mining and sentiment analysis, and then also figuring out how to utilize large language models in, for example, taking the transcripts that I have of interviews and feeding it to a large language model in different ways to answer questions, or to build a large language model that can help me understand the large body of research papers that I've collected over 20 years, and kind of draw down information and insights that I've forgotten or am not seeing. So those are places that I'm really excited to work in, and we're just cracking them open and adding them to the things that we know really well.
Great, thank you. It's been really interesting to hear all the talk on qualitative research, because I'm a qualitative researcher, but also on the use of claims data to do workforce research. I think that's an area where we're moving into, and there's going to be a lot more that we can learn from those methods. So I would like to open it up to the attendees now to answer questions in the Q&A function. And so if you have a question for our panel members, you can just post it in the Q&A. I'm going to start off with another question, though. And I think several of you talked about collaboration. Nöel, I know that you talked about collaboration, and I think, Samantha, you also did. We know that collaboration is really critical for career development and health services research and in health policy. Can you talk about your experiences with collaboration with other researchers, both within your institutions, but also external to your institution? Jacob, do you want to take that one?
I'm happy to. So I'm working on a home health worker study right now that involves, collaborators from organized labor, home health agencies, academia, and the payer, the state Medicaid program. And there's a lot of cooks in the kitchen with that type of collaboration, but it hits on something that a few other folks have mentioned, which is really the value, right, that everybody is bringing to the table there. And not all of those stakeholders have researchers on their teams, but the folks who do have researchers, they each come with a different perspective, and I am constantly learning, in that regard about how folks see the research. The way I might read the research question is very different than the way the home health workers are interacting with the study we're doing right now. I'll say internally, I'm so grateful that I work with folks who have, incredibly wide subject matter expertise. Everybody has kind of their niche, and you'll find this in consulting, academia, professional associations, and I think this is true across the board. There's real value in trying to tap into that expertise when you're both designing and implementing research.
Okay, great, thanks. Others want to talk more about collaboration in the work that you do?
Yeah, I think so, especially in health service research, it's really overlapping of three different areas. It's healthcare, but it's also education, and it's government, because you need the government to fund healthcare, education, but also they regulate industry, and then industry lobbies government. So you can't be from just one. You need to have collaboration of all three sectors. And I'm only, if anything, a government person. So I don't know anything about healthcare, really. I mean, I know how health economics works, but I don't know anything about labs or anything like that. So I have to rely on the healthcare providers that I work with to tell me, what's relevant about the work we're doing, and what are the kind of the key things that they're needing to focus on. And they also have to explain to me why my numbers aren't what they're actually seeing. One example is I built a model in Utah showing we had enough nurses to meet, retirements and population growth, and all of the nurses said I was wrong. And I said, why? It took them a while to look at things and figure it out. And it came down to this issue of, yes, we were producing enough nurses, but we weren't producing enough experienced nurses. So all these nurses were retiring, and all the new nurses didn't have all of the experience of all the nurses that were leaving. And so they were still left short. And so we needed to come up with ways to quantify that shortage of experience in addition to just the stock and flow of providers.
Great example. We have a couple questions coming in our Q&A. And so I'm going to ask our panel members. The first one is, what resources do you recommend to continue growing and refining our research skills? Quantitative, qualitative, mixed methods, everything after completing your degree.
I'd put a plug in for learning R. I think R is probably the best for the work we're doing, but maybe others have different thoughts. And the reason why is that R, being a statistical analysis tool, but also has so many different functions and packages that can, I realized I needed more work in qualitative stuff. And there's packages in R that I can load and learn how to use to run qualitative analysis. So, I mean, that's been a major focus of my kind of continuing education, is just continually teaching myself new packages to be able to write in R.
So Clark, how do you, what resources did you use to teach yourself?
The internet, YouTube,
Okay.
finding books and just going through. There's tons of, luckily, again, with R, it's open source. So there's lots of contributors and lots of books out there that you can go through and teach yourself. But also the great thing is, if you're working, you can find use cases and grab a project and build it. And it's no cost essentially, except your time, because you don't have to pay for your SPSS license or your SAS license or something. So.
And I would echo, honestly, Google is my friend in terms of what I've learned. I have a few websites I use, like I love Laird Statistics. It's $19 a year. We use SPSS, at AAPA as our primary software. And if I had to learn something new, like I had to revisit a factor analysis a couple of years ago. I hadn't done one in probably 10 years, and it walks you through all the assumptions and testing everything for $19 a year. Well worth the money. But everything else, it's figuring out what you need and learning how to Google it. So we're working on an implementation project, science project. I know nothing about it right now. And we're working with some experts in it. But Discovered NIH has an amazing wealth of methodology pages. Like, there we go. So how do I start figuring out and learning how to read to what you need? Because I think the other thing is you can get mired down in how much information is out there. And it's learning how to very quickly read to figure out, is this going to be useful in the long run? And so I'm only spending the time on the materials that truly will help me learn that skill I'm trying to learn. Great,
thank you. There's another question here. what is the most important skill or method you've learned for translating health workforce research for policymakers and healthcare executives?
I think at that level, you have to think about what are the decisions they're trying to make. And they're a little bit different than kind of just showing them, oh, this chart has gotten bigger. So you have to back up and understand the system at large and how they're incentivizing the system or how they need to pull levers to get what they want done. And often their levers are very limited, right? So they can fund more education, or they can incentivize recruitments. But you really need to understand better just exactly what kinds of decisions they're making. And it's maybe an abstraction level above kind of translating the research to something that's understandable at a 8th grade level or something, is to also translate the research into, there has been this growth, therefore you should fund more of this, or you should invest more in this sector.
Any other comments on what skills are needed to translate workforce research to policymakers or executives?
Making things very succinct, like learning how to bulletize everything, and then having the information as a backup, right? Like you have to have the data and the research and the science to back up whatever you're saying. But if you can get it down to the 5 most salient takeaway points that ultimately will lead to the decision, that's really critical and really hard, and only comes through either an incredible talent or a lot of practice.
Practice certainly makes perfect there. I sometimes think about it like you're on Shark Tank, and you have a minute or two to make your pitch. And that frame really helps you cut a lot of very important information, but maybe, to Noel's point, not the most critical points for the policymaker.
Yeah, and I think that that's one of the things I wasn't really taught in school, was like, you are so in the data that getting to the part of like drawing your conclusions and communicating them is not often what is focused on. And so I think that has come with experience and learning from my mentors and my coworkers on how to.
And that's often the hardest part, right? The drawing the conclusions from your work research. What does this mean to practice policy and future research, and communicating that? So we do have another question here from someone who has a master's degree in medical sciences and is working at a cancer center as a non-intervention research study manager. And this person is very interested in health policy, advocacy, and implementation science, and wants to see if there's any recommendations to how to break into these areas. Any thoughts there?
I can't speak to implementation science, but I can say health policy and advocacy. There are a lot of healthcare associations in the DC area, a lot of them. They're almost always hiring. That would be a good place to start at least on the policy and advocacy side, if that's something that interests you. And the benefit, I should have said, this is the other benefit to the work I do, is my work goes directly to Capitol Hills, which is really nice. So on the association front, you tend to be directly helping on that advocacy side.
Great.
Yeah, I think, sorry, I kind of lost my train of thought there for a second, but I think, again, Noel's summed it up there, that there are a lot of professional associations out there who need study managers. They need to know how research that's coming out is going to affect the policy strategies that they're developing. Is this going to cause them to advocate for more of these professionals, or what kinds of action should they take based on research findings? and then translating that over to, great, you can have a finding, but you know, it's a whole other thing to be able to get that implemented in government, or to get an application built and scaled so that it's usable. And so this again requires collaboration with, you know, both the person who does the research, but then, you know, your marketing department, or your strategic planning person, or even your data science team, to be able to build something at scale. So if you're interested in any of those, I think you can always find a position to be part of one of those teams in pushing things forward.
Okay. Great, thank you. We do have one more question here. So this question has to do with building off of your discussion on R. This person asked, what are the advantages of R for data visualization and conceptualization in particular, in comparison to other programs?
I mean, I can answer based on my experience that I think R makes prettier visualizations, and also you can reproduce them a lot faster. You know, I spend a huge amount of time, you know, pointing and clicking in Excel and reproducing a chart by pointing and clicking, where I can just pull the same script and modify one variable and reproduce the exact same thing without any error introduced from me doing it manually. But also it can open massively larger data sets, and then also once you've built applications, can run those data sets at scale, rather than, you know, whatever the limitation is in Excel right now. But so dealing with big data, dealing with volume, velocity, and variety of data, dealing with much wider types of analysis, just with all the packages that are written for it. Anybody else have thoughts on that?
We've been using Tableau a lot for visualizations, and I think talking about the translating piece, because you can create interactive dashboards where people select, you know, what they want to filter by, or the type of graph they want to see. Like, that has been really helpful as for our oral health tracking. And then also it promotes collaboration between the research scientists. So like, I'll go through and clean and analyze the data in Stata, and then pass it off for my colleague to make some cool charts with it, and I don't have to worry about that. So I like using it.
Great, thank you. I want to just take a moment to thank our panel members for such a great conversation around the career pathways that you've taken and some of the research methods that you use. And thank our attendees for joining us today.
Yes, thank you, everyone. I would reemphasize that. It was a wonderful conversation today, and I hope you and the audience enjoyed it as well, and I hope we see you again in the future. Have a good afternoon.